Hi, and welcome back to my channel. Today, we're diving into a very important topic for moms who've experienced a perineal tear in a previous delivery and may be wondering about your chances of tearing again in a future birth and how you can protect your pelvic floor. For those who don't know me, I'm Dr. Ryan Bailey. I'm a board certified pelvic floor physical therapist, and I specialize in pregnancy and postpartum. I have gone through the latest research to be able to provide you the most up-to-date information regarding the common risks of tearing in subsequent vaginal births. And unfortunately, there isn't much. But since this topic is a very personal one based on many factors, it can be challenging to know what is best for you. However, I hope this information helps you start that conversation with your provider into what is not only medically appropriate, but also matches your desires for birth outcome. Now, what you really need to know is if your previous tear has fully healed, and if you have not gone to pelvic floor physical therapy to assess your pelvic floor and the tear, that may be challenging, especially if you had a third or fourth degree tear. But you can also get imaging of the anal sphincter muscles to know if they have fully healed. It's crucial to know if your tissues have properly healed before making decisions about future vaginal births, because then you'll know if they are more susceptible to injury again. But here's the thing, even if your tear is fully healed, you might still notice increased pelvic floor symptoms during or after your next pregnancy, because the pelvic floor muscles might not have fully recovered from the trauma of the previous birth. This can lead to symptoms like urinary incontinence, pelvic pain, or a feeling of heaviness. And that is why going to pelvic floor PT to assess your pelvic floor is so important. So it's not just about avoiding a new tear, but making sure your pelvic floor is fully rehabilitated with enough reserve in strength and flexibility to reduce your risk of injury. Now let's talk about the risk of tearing again. If you had a third or fourth degree tear in the past, your risk of tearing again is higher than if you never had one or had a first or second degree, but it's still relatively low, around 3 to 7%. However, this can vary based on other factors like the size of your baby or how your labor progresses. But even if you don't tear again, if your pelvic floor isn't at 100%, you could still experience pelvic floor dysfunction or worsening symptoms after your next delivery. So making sure your pelvic floor is in the best shape possible is key. So now let's look at the factors that increase your risk of tearing in a subsequent birth. And some of these you have control over and some of them you don't. The first is provider's approach. Now, even though research shows that midwives generally have lower rates of severe tearing because they use fewer interventions like forceps and vacuum extraction, you really want to make sure that your provider just knows the perineum protectant strategies. The second is your birth setting. Again, home and birth centers have lower rates of severe tearing, likely because they promote a slower and more controlled birth, which reduces tearing risks. The third is baby size and position. If your baby is on the larger side, which is generally almost 9 pounds and bigger, or an occiput posterior or sunny side up position, there's more pressure on your perineum, which has increased the risk of tearing. And then there are maternal factors, things like a fast or prolonged labor, certain genetic predispositions, and even how your body's soft tissues respond to stress. And something that you would have to have some provider measure for you is the length of your perineum. Those who have a short perineum are actually at an increased risk of tearing. But even if you are at an increased risk of tearing, there are things that you can do to reduce your chances. So let's look at those. The first is perineal massage. Starting from around 34 weeks of pregnancy, gentle perineal massage can help make the tissues more responsive to stretch, which improves your chance of reducing tearing. The second is warm compresses. During labor, applying warm compresses to the perineum can help soften the tissues, making them less vulnerable. The third, optimal birthing positions. Things like upright or sideline positions can help align the baby's head more easily and reduce the strain on the perineum because you're using gravity. The fourth, controlled delivery. Slowing down the birth of the baby's head using breath control allows the perineal tissues to stretch gradually, which reduces the risk of tearing. And pelvic floor prep. Not only doing pelvic floor exercises that promote flexibility and opening and space in the pelvic floor, but also learning how to relax and lengthen is really important. 6, supportive provider. You want to make sure that your provider supports your birth preferences and experience using techniques to minimize the risk of tearing. In the end, there are factors you can control and factors you can't control regarding your risk of tearing during birth. And so you want to make sure that you are talking to your provider to understand all of your options and take time to prepare your body for the best possible outcome. Thanks for watching, and if you found this helpful, don't forget to subscribe for more tips on pelvic floor health in pregnancy and postpartum.